15th, it's officially Breast Cancer Awareness Month. Breast cancer is the most common form of cancer in women worldwide. And while for a lot of women this can be a scary topic, we need to be in the know about our breasts. Yeah. That's why today we're having an important conversation. So listen up. It's time for What's Up, Doc? Breast Cancer Edition. Joining us is Pfizer's Chief Patient Officer, Dr. Frida Lewis Hall. Thank you so much for joining us today. So great. We're really excited to have you here.
You know, Dr. Frida, let's dive right into this. Now, we know that if we feel a lump, we should call our doctors. But what are some other symptoms that we should look for?
Yeah, so there are a group of symptoms that you want to be on the watch out for with breast cancer. You named one of them, so a lump in your breast, but also lumps under your arm. You also want to make sure that you pay attention to changes in like breast swelling or dimpling and irritation of the breast. Pain is always a sign something's going on. So nipple pain or breast pain. And also changes in the skin. So things like redness, thickening, scaliness, and any discharge from the nipple that is not breast milk that you want to have checked out.
Wow.
Okay. So if any of these things show up, you want to make sure that you go straight to your doctor. And if there are any other changes in your breast, you want to make sure that you've checked with your healthcare provider.
Better to be safe than sorry. Anything.
Better to be safe than
Go
sorry.
ask. Yeah.
Wow. Okay.
I also read that according to the stats in the U.S., breast cancer is the leading cause of death for Latino women. And I also heard that African American women are more likely to get breast cancer and are less likely to survive in each stage. So why is it that more women are predisposed to breast cancer than others?
Well, there are a number of risk factors that we are just not in control of. So I'll give you an example. That's family history.
Yeah.
So if you have a first-degree relative, that would be your mother, your sister, or your daughter who's had breast cancer, your risk almost doubles for developing the disease. And also their inherited risk. So some women inherit mutations of certain genes that increase their risks. So the most common cause of hereditary breast cancer are BRCA1 and BRCA2 mutations. Now, BRCA1 and BRCA2 are normal. We all have those. In normal cells, these genes help make a protein that repair damaged DNA. However, in women that have mutations in BRCA1 and or BRCA2, they may go on to grow abnormal cells, and those abnormal cells may go on to develop into cancer.
Okay.
Understood.
So BRCA1 and BRCA2 mutations occur in about 1 in 500 women in the U.S. However, having a BRCA1 and or BRCA2 mutation doesn't necessarily mean that you'll go on to develop breast cancer.
Wow.
Got it.
Okay, how do you know if you're one of the people that's at risk for breast cancer? How do you know?
Yeah. So
How do you know if I got the BRCA or the BRCA2?
Yeah.
Well, you have it, but whether or not...
If it's mutated, how do you know?
Exactly. So here's what you need to do. Every woman is different, and every cancer is unique. So we need to collect this information. What is your family history? What are their information? What other risk factors might you have? Sit down with your doctor and have a conversation. This conversation will help you know whether or not, when, how, and how often you should be screened, and whether or not you're a candidate for this genetic testing.
Oh, there is a genetic test.
Yes, so there's a genetic test. And this plan, then, you can sit with your doctor and then begin to execute. So I'm going to do this and I'm going to do that. And also, it's really important for you to sit down with your doctor and make this plan. If you intend to get genetic testing, you want to make sure that you understand fully, like, what does this mean for me right when I get the results?
Right.
So really important, sit down, have that conversation with your healthcare provider.
Got it.
Okay, so is genetic testing covered by insurance?
Okay, so that's a depends, right? So it depends on your family history, on your other risk factors. It also depends on criteria that, other criteria that may exist. And then, of course, your insurance that you have.
Right, okay.
Got it.
Okay, so it might be covered. It just depends on your insurance.
Yeah, this goes back to have the conversation.
Right.
Got it.
Yeah.
And you can do self-exams at home, but are they equally as important as going to the doctor?
So they're important to do.
Okay.
I want to make sure that everybody knows that. So breast self-exams are really important, and they're helpful. But alone, they are not enough.
Yeah.
So studies have shown that breast self-exams alone are not enough to reduce deaths due to breast cancer.
Got it.
Wow.
Okay.
Now, so what should you do?
Right.
Right, you mentioned it earlier. Yes, you got to go to the doctor. So
Yes.
you want to get mammography and you want to get an exam by a healthcare provider.
Yeah.
Now, that doesn't mean please don't stop doing your breast self-exams
Yeah.
because
Yeah.
you need to know.
Yeah.
That's exactly right.
Right.
You can't ever be over sure.
Exactly.
Like, over careful.
Because you
Thank
want to
you.
know what you normally look
Yes.
like and what you
Yeah.
normally
Yes.
feel like so that if something changes, you can go right to your healthcare
You
provider.
are such a wealth of information. Thank you so much.
Great information.
Make sure you visit her website, gethealthystayhealthy.com, and it's a great resource. Thank you again for stopping by and having this important conversation with us. For more info, please head over to thereal.com. Now we've got to take a quick break, but we'll be right back. This is The Real.